Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Today, I will be chatting with Dr. Jennifer Smith, a hospitalist at Vernon Jubilee Hospital. Jennifer, welcome.
Thank you.
So, first off, tell me a little bit about what it means to be a hospitalist.
I get asked often, what is a hospitalist? When I tell friends, that's what I do. So a hospitalist is a family doctor that only works in the hospital. Some of our hospitalists, they do have clinics outside of the hospital, but a hospitalist role is to do primary care in the hospital. So acute medicine, when patients are admitted, we take care of the patients whose family doctors don't come to the hospital. And then we also take care of patients who don't have a family doctor or who might be traveling from out of province or out of country sometimes. And we do adult medicine, so that's 17 and over. We don't do pediatrics in the hospital. And yes, we do from the time they're admitted from the ER doctor. If the ER doctor sees them and determines that they cannot go home because they're too sick, or maybe they need more supports and they're failing at home, or they're just too weak to go home, then we admit them to our team. And then we follow them every day until they're ready to be discharged to home. And then that's where the care that the hospitalist has with the patient is finished. And then we pass them back to their family doctor in the community.
So if they don't have a family doctor, what do they do when they're discharged? Like, let's say they have complications after discharge. Where do they go?
Yeah, so that's a big problem, obviously, that everybody knows. A lot of people are without a family doctor, as we call it, unattached. So we do what we can for them in the hospital. If they do have things that need to be completed after they leave, like an ultrasound of their heart, for example, or some kind of imaging that needs to be followed up, sometimes we'll reach out to one of the internists, the internal medicine doctors in the community. And so far, they've been very open to following up on certain tests that need to be done, specifically like an echocardiogram of somebody's heart. They will see them and follow up in the community, which is very helpful, but they won't attach to them forever because that's not they don't do primary care, but they will see them if there's a certain issue that's needed. And luckily, some patients that don't have a family doctor already have, let's say, Dr. Chai as their GI doctor, or they already have an internist that follows them for a heart problem. So they're not completely unseen in the community, but there are people that don't have a family doctor, that don't have a reason to see an internist, and maybe no follow-up tests are needed. And those people, they do ask, and we don't have a good follow-up yet for them. We have our downtown primary care center, and we have a referral form that we will complete to send to them. Unless they have a chronic medical condition that really needs to be followed, it's really hard to get into the downtown primary care center because they're also trying to take care of all of those people. So unfortunately, I think a lot of people are left trying to go to walk-in clinics, and unless they're really sick, then it's the emergency room. Unfortunately, we don't have any other good follow-up yet for patients other than trying to get a family doctor, and hopefully we recruit into our community, get more family doctors that are accepting new patients, which is happening, and nurse practitioners as well. But I think they fill up very quickly.
Yeah, lots of fascinating things happening with recruitment in our community right now. So we are actively trying to solve the problems, which is great. So tell me how it would be different being a hospitalist in Vernon versus being a hospitalist in Vancouver or Kelowna.
Yeah, so one reason I'm here is because I do like my job here in Vernon. They do need hospitalists across the province as well as family doctors. But I do like Vernon as a community because it's not super rural or remote, but it's not one of the bigger centers. I think for me, it works well in that we have support, we have internists that help us, but we do take care of lots of sick, complicated, and complex patients. And for me, I like that. I like to be able to see a variety of people. And I feel supported by the specialists that we do have in our community, but we do get to see quite a variety of patients. And I like that, everybody knows each other in the hospital mostly. Like, you show up to work and everybody recognizes that somebody new is around. Who is that? People say hi. I think we have a really good work culture here where the nurses and the doctors work well together. I mean, healthcare is obviously not great right now. Nurses are short-staffed. Everybody's short-staffed. Everybody's burnt out. But I feel like we still have kept a nice working culture here and environment where people can still, I think, smile and be nice to each other. And It is hard though. I mean, our hospital is short staffed like everywhere else, but I like the mid-sized community. We're not super remote or rural, but we're also not a big center where we don't have any specialists that admit to our hospital outside of the ICU. So we do manage all of the patients in the hospital who are admitted for acute medical needs. Yeah.
So what kind of hours do you work?
So hospital is scheduled from 8 to 6, but yeah, our schedule has changed a bit over the years depending on because our program continues to grow because family doctors are giving up privileges. So we're getting more patients on our service. The community is growing. So our program has grown a lot since I started back in 2016. Currently we're 8 to 6, 8 more until 6 p.m. We do 6 days and then we do a night. So at 5 p.m. our evening doctor comes on. So they start taking calls for us. So I'm responsible for my patients during the day. And then 6 p.m. I can go home. I don't have to worry. I know my colleague is taking over my patient's care. And if any concerns come up, they're going to deal with that. So that is nice. I can walk away from work after 6 p.m. And then the evening doc works from 5 p.m. till 1 in the morning on site. And then they take call from 1 a.m. till 8 a.m. in the morning. So that's any ward calls or if a patient is getting sick overnight, then they will go in and see that patient in the hospital. But our hours can be quite long if we're short staffed, which we often are, and high workloads. So we're working with our program right now and our team to try to recruit and change our schedule. We need probably 4 full-time doctors to join our team to make the workload lighter, more manageable. Right now it's quite heavy. So we are here sometimes up to 12 hours a day maybe, but ideally 10 hours a day.
So what's your favorite part of the job?
My favorite part is the team environment. I like in the hospital, we work with, the nurses obviously, but then also the physiotherapist, our transition liaison nurse that helps with discharge planning, the social worker, the pharmacist, consults to the specialist as needed. So it's really a team environment and we work everywhere in the hospital. So we go to every floor except for the ICU. So we get to meet all of the nurses in the hospital, all of the physiotherapists, the dietitians, the speech therapists. Like we have a huge team in the hospital that I don't know if people are aware of. So I do like that because I feel like if you're in a clinic, you kind of work more on your own. You have your MOA, but most clinics don't have that team support. So I feel like that makes our job a lot easier, getting patients all the things that they need while they're here in the hospital. And I find the medicine really interesting as well. I do like acute medicine.
So you're a mom, and I know that most moms struggle with the whole daycare situation and raising kids and managing work, and you're doing it on top of having night shifts and long hours. How do you make it work?
Yeah. That is very challenging. Yeah, I luckily I have a partner who works part-time, and his job is he's very supportive, and his job luckily is supportive in that he can be flexible on his start and finish times. Otherwise, I don't know how we would make it work because our drop-off times are 8:15 and 8:45, and I start work at 8. So, and our pickup time at the latest for one of our children is 4. So we have limited, pickup drop-off times. My team is also flexible with me if I have to drop off a kid or pick up one of my kids, but that is challenging. Daycare is a huge issue in our community, long wait lists, and we have been lucky. The school division actually here in Vernon just started before and after school care, luckily right as our oldest started kindergarten. So we were lucky to get on that list, and now they've expanded the program. So that's very helpful for parents. There is a before and after school care program, but really it's just juggling everything every day between me and my partner to do the pickup and drop off. But it's very busy. Yeah, for sure. And then there's the after school activities, and we're making it work, but it is very busy.
Well, thank you so much for finding the time to speak with me today. I'm speaking with Dr. Jennifer Smith, a hospitalist at Vernon Jubilee Hospital. I'm your host, Sharon Hughes-Geekie. Tune in tomorrow for another episode of Docs of Vernon. See you then.